In this session, I'm going to review another method to use webbing for victim rescue. If you remember, in the previous video that I posted, I discussed the different types of webbing that I carry, and I demonstrated a faster way for a single firefighter to don a full-body hasty harness onto an unconscious victim using a 9-foot webbing loop. In this video, I'm going to talk about another section of webbing that I carry, and that's a 5.5-foot loop. This webbing is made from a 12.5-foot length of 1-inch tubular, and I carry it in a straight roll and store it in the left pants pocket of my gear. Now, the straight roll is probably the most popular way for firefighters to carry and store the webbing. And this is a typical setup that you're going to see. The webbing is rolled out very similar to a section of fire hose and placed in a rubber medical glove with the water knot on the outside. Now, the rubber glove does a few things. First of all, it keeps the straight roll compact and prevents it from unraveling. It also helps to keep the webbing clean and dry. Remember, moisture, dirt, and debris can get through the outer shell of your gear, especially as your gear gets older. So the rubber glove just adds another layer of protection to your webbing. Another thing that you'll see firefighters add to their webbing loop is a carabiner. Now, this is a great idea and something I highly recommend because it simply just adds versatility to your webbing loop. I personally don't carry a carabiner on my straight roll, as I have carabiners on my other sections of webbing. A couple other things that I do differently. I roll up my straight roll with the water knot on the inside, and I don't place it inside a medical glove. I've tried the rubber glove in the past. It just didn't work that well for me. The webbing didn't deploy as fast and as efficient as I wanted to, so I got away from it. Now I just simply put the webbing right inside the pocket. If you see this tail coming out, this is what the webbing would look like on the inside. When I want to deploy it, I simply locate that tail, that free end, and pull it straight out. And it deploys very quickly and efficiently. Now, this is a setup that works for me. But as I mentioned in the past, in the end, you have to use what you like and what works best for you. But as I mentioned again in the previous video, the key is that however you decide to store your webbing and carry it, that's how you want to practice deploying it. Remember, our goal is to get this victim out as quickly and as efficiently as possible. If your current setup isn't conducive to achieving that goal, then you may want to reevaluate and make some changes. So with all that being said, let's talk more about the technique itself and show you how to attach the webbing to the victim. Okay, the technique that I'm going to take you through and that I demonstrated in the beginning of the video is called a girth or choker hitch. Now, this hitch has a lot of uses, but it also works very well for dragging a victim. Unlike the name states, the webbing doesn't choke or cut off the victim's breathing. However, I'm not going to lie to you. If you're applying this webbing to a live, conscious victim, it is going to be uncomfortable. After all, the webbing does cinch up and bite down around the victim's chest, but that's what makes it so effective and helps prevent the webbing from getting pulled off the victim. I can tell you this, we've applied this webbing, this hitch, to numerous live victims during training of all shapes and sizes and never had an issue. So let's go through the important points you need to remember. First of all, if you find the victim prone or on their stomach, you're going to want to flip them over onto their back. This is how you want to apply the webbing, and this is how you want to drag the victim out. You don't want to be dragging them out on their face. When the victim's in proper position, you're going to set up behind the head. Now, like I said, however you store and carry your webbing, that's how you want to deploy it. That's your starting point. The advantage of the technique that I'm going to take you through is that you never let go of the webbing. It's in your hands at all times. And whatever technique you use, that's your ultimate goal. If you let go of the webbing in a fire environment and reduce visibility, it's going to be difficult to locate it on the ground with your firefighting gloves. So try to keep the webbing in your hands as much as possible. So I have that loop on my left pocket. I locate it and pull the webbing out. My left hand stays on that loop that I pull out of my pocket, and my right hand goes to the middle. I'm going to bring the webbing to the waist. I'm going to grab the hands, lift them up, and flip the webbing underneath the forearms to get it past the hands and fingers. Then I'm going to slide the webbing up high up on the victim's chest. This is important. If you start to cinch the webbing up around the victim's waist, as you go to pull on it, there's a tendency for the victim to fold in half. So get this webbing loop high up on the chest, underneath the shoulders and armpits. As I do that, I'm going to make an opening on the left side with my fingers. And I'm going to keep that section of the webbing high up on that left shoulder. My right hand slides to the end of the webbing, to the water knot. And I'm going to pass that knot underneath the victim's head and through that loop that I made on the left side. Now, I like to bring the water knot through. It's just easier to grab, plus it keeps the water knot away from the victim's body and allows the webbing to cinch up tighter around the chest. By keeping this webbing loop high on the shoulder, as I pass the water knot through and pull on it, it's going to bring that bite or cinch point in line with the victim's spine. And that's your goal. That's also important. You want to keep that bite or cinch point in the center of the body or in line with the spine. If it's too far offset on the left or right, as you go to pull on it, especially if you're making a 90 or 180 degree turn, there's a strong likelihood that you're going to flip the victim over onto their stomach, onto their face, and you don't want that to happen. So to reduce that likelihood, try to keep that bite or cinch point directly in line with the spine. Right in the center, it should be right underneath the back of the victim's head. Let's take a closer look at that. Locate and deploy your webbing. While holding on to the end with your left hand, find the middle with your right. Come to the waist. Lift the hands up. Flip the webbing underneath the forearms to get it past the hands and fingers. Slide the webbing high up on the victim's chest, underneath the shoulders and armpits. Make an opening with your left hand, keeping the webbing at the top of the left shoulder. Find the water knot with your right. Come underneath the victim's head and pass it through the loop that you made with your left hand. Pull on the water knot to bring the cinch or bite point in line with the victim's spine. It should be right underneath the victim's head. Adjust it left or right to get it into that position. If that cinch point doesn't end up directly in the center, you do have the ability to grab it and slide it left or right to get it exactly where you want it. Okay, if I'm the only firefighter dragging the victim, I'm going to deploy my 5.5 foot loop. However, if the size and the weight of the victim requires 2 firefighters, I have the option of deploying my 9 foot loop, which is going to give me additional webbing. This will provide more separation between me and the other firefighter as well as the victim. In other words, it's going to keep us less bunched up and give us more room to work, especially if we're working in a confined area such as a hallway. As far as the different drag techniques themselves, they're obviously going to be based on the conditions you're encountering. If I'm forced to stay low on my hands and knees, I'm going to grab the webbing with one hand, and I'm going to use my other hand, or even better yet, a tool to assess the floor in front of me for any loss of integrity or any obstructions that might be in my way. If I don't have a tool, another option is to kick your leg out in front of you and perform the nozzle man floor assessment technique. Now, if conditions are a little bit more in my favor and I can stand, even if I got to crouch down a little bit, that's what I want to do. Working off my feet, I'm going to have a lot more power, a lot more drive than I will on my hands and knees. Okay? You can still use a tool to assess the floor in front of you. If the victim's a little heavier and conditions will allow me to stand up safely, I want to do that. It's going to do a few things. First of all, it's going to put me in a more comfortable position. Also, by standing up on a heavier victim, I'm going to put them more in a seated position. That's going to reduce the friction of their body in contact with the floor. So that's going to create less resistance, less load on me. In other words, it's going to make it easier for me to pull out that heavier victim. But again, the conditions have to be in your favor so you can stand up. If you need to make a 90 or 180 degree turn, I recommend that you lay the victim back down flat on the floor and keep the webbing as low as possible. That way when you make the turn, there's a lot less likely of a chance of you flipping the victim over. So keep that webbing low, keep the victim low. Once you can get back in line, again, if the conditions will allow you to safely stand, you can sit the victim back up. Pull them out. Quick teaching point I want to mention. When you're practicing your drags, just don't do it on an apparatus floor. Any concrete, wood, tile, smooth surface is not going to have the same resistance, obviously, that a thick, shag carpeting wood that you might encounter in a residential setting. When we're practicing our drags, whether it's at the college or at the firehouse, we actually roll out remnants of carpet. They're 20 feet wide, 20 feet long. We put them in line with each other, so we have a 20 by 40 foot run, and that's what we practice our drags on. It's much more realistic and helps you evaluate your technique and see what's going to work best based on that type of resistance. Plus it's a little bit easier on your knees and your gear as well. If you don't have carpet and conditions will allow it, decent weather outside, you got grass, that's another alternative. The goal here, guys, is don't make your training easier. Make it harder. Okay, make it more challenging. That way when you encounter it in the field, it might not seem as bad as what you had in training, and overall it's going to be easier for you. Alright, to wrap things up, there's a few final points I want to talk about. Realize that webbing isn't a cure-all. It's not the perfect solution for every situation. You really got to know when and when not to deploy it. Now the criteria that I use to make that decision is based on 3 considerations. First is the fire conditions, the amount of heat and smoke present. Second is the structure itself. In other words, how compartmentalized is it and how much furniture and debris is in my way. Third is the victim, their size and their weight. Now if those 3 factors are in my favor and I can simply just do a grab and go, or pick the victim up and carry him out, or throw him over my shoulder and run out, then that's what I'm going to do. We should always gravitate to the fastest and easiest method. However, if I need a better handhold and the amount of time that it takes for me to deploy the webbing is going to save me time in the long run, then using webbing is a viable option. The key is that you recognize the difference. Now to put this in clearer perspective, I'm going to share with you 2 rescues I was involved in. The first incident really wasn't a rescue, it was more of a removal. It involved a teenage kid that was trapped on the 2nd floor of an apartment fire. He was conscious but had a broken leg, full cast, all the way up to the hip. Smoke conditions at their worst were moderate, so I was able just to pick the kid up and carry him out. The second incident was much more severe. It involved an elderly female that I found unconscious just outside the main fire room. Now she was a small lady, so I was able to do a grab and go. Besides that, the fire conditions were so severe, I didn't really have too many other options. 15 seconds after I pulled her out of the room that she was in, it flashed over. Unfortunately, she ended up dying a few days later of her burns, but both of these incidents reinforce the point that I'm trying to bring across, and that is, I train with webbing extensively. And I never even considered using it in either situation because it wasn't the right call. It wouldn't have provided any advantage. But let's face it, guys, the reality is this. Most firefighters will never even have the opportunity to pull an unconscious victim out of a structure fire, while others have and will do it multiple times. Even if you have the opportunity to do it only once, you want to be able to say you did it right and that you did everything possible. So the question is this: how do we prepare ourselves for a situation that we're rarely going to encounter in the field? And the answer is quite simple. It's through training. Now the best comparison I can give you is professional sports. When you look at football, how often do you see a professional running back rush for more than 200 yards a game, or a quarterback throw for 5 or more touchdowns? In baseball, how often do you see a no-hitter or a triple play made? How often is a world record broken? Yet, those professional athletes train countless hours so they can execute flawlessly and make the seemingly impossible or unlikely happen. Well, our profession is no different, except how we perform or execute may mean the difference on whether somebody lives or somebody dies. Now, without trying to sound overly dramatic, I'm going to leave you with that thought. Hopefully I'll see you next time. Thanks for watching.